just so everybody's aware on the webinar, we'll move into the question and answer section. So this is slightly less structured. So any clinician who would like to answer one of these questions, just go for it. So I've got a few given questions. So some of those questions that have appeared on in the question and answer function of this webinar are also some of those that have been submitted before the webinar. So we'll go through some of them step by step, and it should answer some of those as we progress. So the first question I think that came through was a particular person, their mother has the myog gene, which she took on from her father and mother, who were not related in any way. I have an appointment booked for the genetics as I have some symptoms. How long do people with the myog gene live for typically?
Francesca's nodding her head there. Francesca,
I mean, myog is the one of the recent discoveries, so we don't have long-term follow-up of people with myog. I'm not surprised that there is a patient with carrying 2 mutations, parents unrelated, because one can inherit one variant from a parent, a different variant from the other one. It's the combination of 2 copies with a defect which increase the risk to develop the disease, as in this case. Yeah, we don't really have information from the medical literature on the prognosis of myog-related Fahr disease.
I want to add here that it's important to emphasize that every individual is different. And generally one would say that Fahr's, it doesn't matter which gene it is related to, is generally a slow condition. It's a very slow condition. Many of the people might have had the calcium in their brains for a very long time without having any symptoms. So I think to the prediction between the amount of calcium deposition, as you might see on the scan, versus the symptoms is very poor. So I have people who have lots of calcium in their brain and have hardly any symptoms at all. And then I have people who have less amount of calcium, but they have symptoms. So there isn't a correlation. All what we can say is that generally speaking, this condition is very slowly progressive, and people may have very few symptoms or no symptoms at all. So it's very difficult to prognosticate in this situation.
Thank you.
And also carrying the mutation is not, I mean, all these conditions have a reduced penetrance, which means that even if you carry the mutation 1 or 2 for the recessive genes, it doesn't mean the person is going to develop symptoms. And we also have some example of people carrying the mutation and not having evidence of brain calcifications. So every patient has a different story.
Thank you. So a very idiosyncratic picture. Okay, so the second question. I have Fahr's, genetically diagnosed with it at 33 years old after finding bilateral basal ganglia calcification on an MRI. I have had white matter changes shown since I was 17, but only progressive changes in the past 5 years. It has been stable now for about 2 years. Are the two connected, the white matter changes and the Fahr? So I think that kind of links to what Professor Bhatia was saying.
So I don't know if it's very likely that there is a link. It would be very unusual for you to have 2 different disorders. So there may be a propensity for involvement. I don't know the case. I can only answer in general. So without knowing a person individually and knowing the exact details of the case, it's very difficult to be very exact in this. So one has to be just in general, it's very likely that they're related. And there could be certain types of genetic conditions which can give you white matter changes and give you calcification in the brain, including one disorder which we haven't mentioned so far, which is called mitochondrial disease. So I don't know this particular individual case, but the simple answer is it's very likely that they are connected.
Thank you. Okay, so the third question. Husband has Fahr's disease and has dystonia, tremors, and foot drop. Deep brain stimulation was recommended as an option for him to consider. Can you please talk more about deep brain stimulation and if it could help a patient with Fahr's?
Well, deep brain stimulation is, as the name implies, is stimulation using electrodes in a deep part of the brain, including which is the basal ganglia. Generally, for people who have dystonia or Parkinsonism, in this context, one would stimulate a part of the brain called the GPI, globus pallidus internal segment. And the short answer here is that if that area of brain is already damaged from the calcium, then it would be obviously very tricky to put electrodes in that area. If that area which they want to target does not have calcium, one may consider it, but the outcomes from DBS in this situation is not as good as people who have dystonia, etc., without calcium or damage to the brain.
Henry, you looked poised to speak as well.
Yeah, no, I've asked this question of the surgeons before, and you know, once the calcium is there, there is cell damage. It'd be very difficult to put in a deep brain stimulator to make or to change the patient clinically. I think it will be very, very hard. And also, this is solid calcium, and I presume you would almost break the electrodes, wouldn't you, if you put this in against a solid calcium where there's already damage done. So I would be very wary of thinking about DBS in people with significant calcium already there. That would be my feeling.
Thank you. Okay, our next question is, do you notice a higher rate of childhood diagnosis of neurodevelopmental disorders such as ADHD in Fahr's patients compared to the average population?
I don't know of any trial where or any study where they have compared prevalence of ADHD in Fahr's versus the other population. So I'm afraid I can't answer that.
I mean, if I saw ADHD and a scan that showed Fahr's, I'd be questioning whether this is just ADHD. Is this more of a complex childhood disorder? That would be what I would be thinking. Because I think common ADHD, they don't have Fahr's, do they? You may get ADHD-like, and I imagine it's a spectrum. I'm no expert, but I imagine it's a spectrum-like symptoms. I think that's probably going to be part of the Fahr's syndrome.
And the point was, is it higher? And the answer here is that we don't have a study to make that association.
No.
And sort of a follow-up or a link to the next question, which would probably be along a similar sort of response basis, is there a link between the parent having Fahr's and children having neurologic needs such as autism?
Well, if the children have the gene and presumably they have also, or if they have the calcium in their brain, one would make the assumption that the symptoms you're seeing could be related to that. But if they don't have it, then the autism or whatever you see in them could also be incidental.
Thank you. Final question from the pre-given questions, and then we might have a few minutes to get on to some of the questions in the Q&A section here. And I don't know if this is for me to answer, actually. Is there support groups that me and my family could join to gain support locally? And I think we need to be careful here of what we mean by locally. So if we take it maybe as a UK basis first, does any,
I think you got to answer that, Adam. It's your area.
I'll answer that. Okay, well, as far as we're aware, or I'm aware, Far Beyond is one of the only, well, the only dedicated charity, certainly within the UK, to Fahr's disease. There are other groups that work across multiple neurological conditions. Far Beyond, we're trying to create that community. I mean, there's a fantastic online supporting resource. So I know Erlen's on the call. This Facebook group that Erlen set up, which is a fantastic resource. There's the Faraway Friends. There are some different groups online, but in terms of local, as in physical presence, unfortunately, I think because the community is that small, it's very difficult to provide that sense of community organizing. Although the ambition of Far Beyond is to have a couple of events, with looking for next year to have a face-to-face event with clinicians and patients, so more of a patient engagement event. And I think when people are accessing the services, certainly at the National Hospital, Henry, Amit, the rest of the team, Francesca, Kailash, do signpost people to Far Beyond. And so we're trying to build that community. So that's as much as I can say on that front, I think, at the moment, but we're trying to be more active. Outside of the UK, I'm less clear on, and I'd probably want to defer to people. I know that there's a group in Italy, and I know that there was a group in Canada. So yes, there are a few things, but not loads because of how small the community is. Okay, I'm going to pick up on some of the questions that was put into the chat, and I can see that Francesca's said that she'd like to answer a couple of live questions. So with regards to FARS, is there any early detection testing? And that's for Francesca. You're on mute.
I interpreted this as a question about genetic testing and
genetic question testing.
Yeah.
Sorry.
So yeah, so just to explain, our DNA is essentially the same from birth. So whenever we are testing it, if we test it and there is a variant in the gene we are testing, we can detect it if we are 1 year old, 50-year-old, 80-year-old, essentially. The fact is when it's right to test it. So I think Professor Houlden might reply better than me on this, but we usually start genetic testing when there are symptoms or when there is a family history, and so a person wants to receive counseling and predictive testing regarding a specific disorder, if there is another family member with a confirmed diagnosis. So in this way, early detection testing means we can, of course, screen the DNA and find the mutation if another family member has been tested positive for the same condition. But we are not suggesting testing if there are no symptoms or no family background of this.
Thank you. And I think we've got time for 2 quick questions before we draw to a close. So one here is, can Fahrs be misdiagnosed, and could this worsen the prognosis if intervention is late?
So I think to say, when you say misdiagnosed, it's sort of a tricky question. One thing to keep in mind is that sometimes one may see changes on an MRI scan, which may be misinterpreted as being as not being calcium. They may be thinking about it as iron or something else. And a CT scan needs to be done to check when you have a suspicion on the MR. A CT scan will show the calcium better than it may show on an MR. So that's one potential area. The second is where you've gone with the symptoms and nobody's done a scan. As we said, the diagnosis is based on looking at the typical changes of the calcium deposition in an MRI scan. You can't make the diagnosis looking at the person just physically. So the diagnosis is based on doing the scan. So somebody might have gone with some symptoms and there is a delay before orders a scan. So that can happen. Now, will that have worsened the situation? Well, we already mentioned to you that we do not have a curative treatment. So we couldn't have put right if there had been any progression of the calcium. However, if the person has suffered unduly without their symptoms being treated, well, that of course it can be an issue if the diagnosis wasn't made.
Thank you. So our final question, and then we'll draw to a close. So are there any particular foods or types of behaviors one shouldn't engage in to maybe slow the rate of Fahr's progression?
So again, I think people have this, perhaps they have this notion that if they eat too much calcium or if they reduce their calcium, that might sort of somehow change the calcium in the brain. And what I think I want to emphasize to people is that in most of these genetic disorders which we are talking about, the problem is that the barrier between the blood vessels and the brain itself. It's not the brain has what we call a blood-brain barrier. So things which you're doing in the periphery may not necessarily affect what is happening at the level of the blood-brain barrier in the brain. Obviously, in certain metabolic disorders where the calcium and the phosphate are involved in the periphery and have an issue in the brain, that of course is important. But in many of these genetic conditions, what you do in the periphery does not affect the calcium in the brain.
Is there anything that Henry, Francesca, Amit, you'd want to comment as well on one of that question?
Yeah, I think my answer was going to be no anyway. So nothing you can do practically at this point in time. And the only point I would emphasize is it's important to say that here is we do not know enough, because whatever we are saying is based on very few studies from a very small cohort of patients that we have literature on. And the point I want to emphasize is we need to collect good data, good outcomes, good scientific information to be able to answer the questions that were asked today. We don't think we have the answers, and that is a good starting point. I think we need to find these answers, and that's why we need to work together.
Very, very important point. Yeah, well said.
Yeah.
Fabulous. Okay, thank you, everybody. I think that draws us to the end of the hour that we've had together. We hope that this has been a useful session for everybody who has joined us or watches this afterwards. And this is designed to be the first sort of stepping stone to future events, as well as research becomes hopefully richer in terms of both hopefully financially, but in terms of what we know about Fahrs. And we will make slides available, this recording available, and any questions that have been put into the chat today that we haven't managed to get around to, we will produce some answers for those, and they'll be made available with this recording as well. As I've said, Far Beyond's been working really hard to support the community, the FARS community, to start those conversations and to really move forward with potential research pathways. And that's something actually that Francesca and I, and hopefully Amit possibly, will be doing in a couple of weeks' time, starting that conversation with the pharmaceutical sector. So I just want to say, leaving on a note of hope, that there is hope that we can look to do more, but it's only by engaging in these conversations and raising that awareness that is so vital, that we do spread the word about what FARS is. And so thank you for joining us today, and thank you to our panel of Professor Bhatia, Professor Houlden, Dr. Magrinelli, and Dr. Batla. So thank you very much.
And thank you, Adam, for putting this together. I think this is a really important forum for patients, and your input is essential for us as well, to help us, you know, portray our words and feelings too. So thank you very much.
Thank you.
Thank you.
Thanks, Adam. Bye.
Yes. Thank you. Bye-bye.